Hello and welcome to Health Matters on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. Today we talk about spine health. The human spine is made up of 24 small bones called vertebrae. These vertebrae are stacked on top of each other to create a spinal column. Between each vertebra is a soft cushion called a disc that helps absorb pressure and keeps the bones from rubbing against each other. The spine supports the body and allows one to move and bend with flexibility. It also protects the spinal cord, a column of nerves that connects the brain to the rest of the body. This year, the World Spine Day is emphasizing movement of the spine. On the show with me is consultant orthopedic spine surgeon at the National Orthopedic Hospital, Igbobi, Dr. Mustafa Alimi. You are welcome to the show, sir.
Thank you very much, ma.
You know, I don't think many people think of the spine as something that can move, with a deliberate action, maybe involuntarily or whatever. Tell us how we can move our spines with intention.
Thank you very much. First of all, let me comment on your intro. It was a fantastic intro.
Thank you.
In actual fact, you've done half of my job for me. Now, you talked about the vertebral bodies stacked on each other, separated by a disc in front and at the back by two facet joints at every level. Each of those facet joints are just like small knee joints, and they are designed to allow, just like you said, you and I to be able to bend forward, bend sideways, pick up things, look right, look left. Now, by design, the spine is designed to move. Otherwise, it would have been one rigid structure, no intervening joints. We talk about 24 bones. Intervening joints are like 24 in front and 24 times 2, 48 at the back. So God, in his infinite mercy, designed it as a mechanical tool for you to move. Now, failure to move it can now add to the diseases of the spine. So the WHO, when they chose October 16 as the World Spine Day and their theme as movement, move the spine, is because they discovered that diseases of the spine that are preventable are much more common than hypertension, diabetes, stroke, cancer, all almost put together. So if you can encourage people, advise, counsel, help them to move, you will eliminate a significant number of diseases that you have to spend money managing. So that is it about move your spine.
So am I right then to say that moving the spine occurs naturally when you move your body? It's not something you have to pay attention to. Now let me move my spine. I have to do this, I have to do that.
No, that is not absolutely correct. The fact is that whether you want to or you don't want to, like you sat there now, you nodded, you moved, so your spine will move. Now, but what we are asking you to do is to do the deliberate one, because the deliberate one makes you move it more often, over a wider range of motion, more actively, and then you exercise those joints and your body as a whole to a more reasonable limit, rather than just passively moving it. If you sit down on the TV and you watch a comedy and you laugh, and your spine will move. But that is not, if it was designed for just that small movement, then you wouldn't have so many joints and so many muscles supporting it. So what we are advocating for is for you to deliberately improve, increase, actively move your spine for your health.
Okay, so are there people who maybe from birth or for some reason have challenges moving their spines? Not because of disease, but just, maybe congenitally or something?
The fact is that even when you say something is congenital, it's also a disease.
It's also a disease.
So it is not normal for anybody to be unable to move the spine. It's only diseases that will stop you from moving the spine. Either it's congenital, or it's traumatic, it's infective, it's tumor, it's athletic, that will stop you from moving your spine. So everybody's spine is supposed to move. Now, if you look at pathologies or diseases around the spine, it's much more common at the lower spine, that's the low back. Of course, every level of the spine can have one disease or the other. But what the World Spine Day is about is the ones that you can prevent, the ones that you can avoid.
What are these diseases that can be avoided?
Okay, fine. Let's look at them. First of all, they vary with age, gender. Now, the commonest age group that gets inflicted by diseases around the spine are from the ages of 45 and above. You know, I'm not saying that like I said, everybody can get afflicted, but 45 and above is commoner. Now, what it is that at that age, your joints, you can imagine joints that you've had since birth. You cough, you nod, you don't even move actively. You sleep, they're always moving. You're breathing, they are moving. So they've moved for almost 45 years.
You move while you breathe?
Yes. For you to breathe, you must expand your chest wall, right? Your abdomen will move. As you move, your spine will move. It will flex and extend. You just move. If your spine, your low back, for example, is unstable, movements will become, even breathing and coughing will become painful. And you've had people say that even when I cough, I feel the pain in my back. So it's always moving. So as people grow older, naturally, degeneration sets in. That is naturally, not the ones that is accelerated.
So that's something you can't help.
You can't help. So, but as it's setting in, then the body demands for you, for it to keep moving, for it to keep being useful to you, you have to move it more.
Okay.
For a child, for example, you can't even stop them from moving. You can't hold them back. So they are already developing their bones, developing their muscles, developing their joints. But as you grow older, maybe by work, lifestyle, maybe you're sedentary, maybe
sitting in front of the computer.
Couch. Yeah, computer is even nice. If you sit in front of the computer, maybe you earn a living from that. What about those who sit in front of the TV all day? That's even worse. And now we're in a world of sit at home and order. Everything just at your fingertips, either on your phone. So the less people move, as they grow older, it becomes more difficult to move. And I'll explain how it happens. Now, the spine is not made up of just, you talked about the bone, you talked about the disc, I talked about the facet joints at the back.
Yes.
Now you have muscles, and those muscles are very important. You have ligaments. Those ligaments are also very important. Now, anywhere you have muscles, the rule is that you should tone them, because if they're loose tone, they will not give you the impact that they're supposed to give. Children, automatically, their muscles are toned. They jump, they run. They're always doing things that we think may be out of place. When we were kids, our schools had playground. Children need to play to tone their muscles and then make their ligaments stretchable to be able to tolerate stretch, make it more supple. Now, as people grow older, naturally, your ligaments become less stretchable. Your muscles lose tone. So you have to actively make sure that your muscles maintain some tone and your ligaments maintain some stretchability.
Okay, so exercises are usually divided into types. There's the aerobic, there's the strength training and all that. What kind of exercises help toning and stretchability?
Very good. The truth is that there's no exercise you do that does not have an impact on your spine.
Okay.
Is that some of them have less impact than the other. There's no exercise. Think of any exercise. What we do is we encourage our patients to do exercises that they enjoy. Otherwise, they can't sustain it.
Okay, so maybe somebody just enjoys cycling.
Cycling is very good.
Walking.
Very good.
Okay.
Swimming, very good. Table tennis, very good. Lawn tennis, very good. Football, super. So any sport you engage in, whether by act of omission or commission, whether you want to or you don't want to, it has an impact on your spine. Then there are specific exercises that are taught by physiotherapists that are for the spine. Now, those ones are usually taught as therapy.
Okay.
But what we do is we encourage people that, look, do the exercises that you enjoy to do.
Okay, why would somebody be visiting a physiotherapist for therapy when he can move his body himself? What condition would that be?
At that stage, that person requires more than just moving it yourself. You require other things. You've seen the orthopedic surgeon, the spine surgeon. He has seen other pathologists. So you need to be jump-started, if I can use that term, by medications and physiotherapy. So at a particular stage, just like once you jump-start it, then you continue.
Okay,
doing
there was
your thing
something we
yourself.
omitted. You were going to tell me about diseases, diseases that can be prevented when we do move our spines.
Okay, let's start with that. I didn't omit it. Actually, I started it. I talked about stretchability.
Okay.
I talked about muscle toning. Now, naturally, as we all grow older, we lose bone stock. Bone stock.
Bone stock.
Yes. Everybody has bone.
That's density?
Stock. I'm using the stock. I'm deliberately using that term, stock. S-T-O-C-K. Stock. So what you keep as your bone, as you grow older, you tend to lose it.
Wow.
It's a natural phenomenon. Now, it now differs from male to female. When I say old, I'm talking about middle age.
Yes.
I'm not saying 25,
I already
26.
know ours is more.
Yes. Now, for women, it is they lose more and they lose it more rapidly. So, but when you have a good bone bank, then you lose, even if you are losing, whatever, like money, whatever you have left is still reasonable, and then you try to support it. Okay. So this is how it comes. When you do exercises, your muscles, you stretch your muscles, you stretch your ligaments. Those things are attached to bone. So the bone gets the message that this gentleman, this lady still needs me. So the body will be instructed, keep depositing bone to that person. He needs it. Deposit calcium, deposit everything that will make the bone stronger. If the person doesn't have it, like women who are losing very, very quick, very rapidly at that middle age, we now give them supplements to keep depositing bone. So if you take, for example, an x-ray of somebody who's an athlete, somebody who was athletic, at 50, the person still takes some walk, plays tennis, against the same age group and gender of somebody who doesn't, their bone stock is different.
And the athlete has more bone stock?
Definitely.
Incredible. So he's using it more, yet he has more.
No, he's using these muscles and ligaments more. So he jumps up, he rolls down. So the body, the information to the body is that, look, I need you, Mr. Bone. I need you. So the body will respond by depositing bone in that person. The person will have stronger bones, stronger muscles, better toned muscle, more supple ligaments. Because you are...
And this deposit, as you call it, can continue into old age?
With supplements, you can maintain.
Okay.
The best time for deposit is childhood.
Okay.
Adolescence.
So if you didn't pay attention in childhood, you're going to pay for it when you're older.
Definitely. So when you ask children, go out and play, as they are jumping up and down, the message they are sending to their bodies are, look, this man needs his bone, he needs his muscles. I mean, what is the logic? What is the pathway to people who go to the gym developing muscles? That's what you do, is that you just work the muscles. Okay. And you send a message to the body, I need you. So each time you carry more weight, you put the muscles under stress, the muscles will develop, they will get tougher and stronger.
Okay, this is very interesting, but we have to go on a break. Stay with us. We're going on a short break, and join us in a moment. Welcome back to the program. It's Health Matters on Channels Television, and we're talking about spine health. We're here with Dr. Mustafa Alimi. You can call if you want to ask questions on spine health. The number is 0808-054-2233. You can also send me a message on X at ctv_Mary A or email at moalale@channelstv.com, excuse me, while we continue the conversation. So you spoke about supplements. Does that mean that spine health has dietary implications?
Definitely. Definitely. If you look at the theme for the World Spine Day, basically it's been broken to about 3 or 4 parts. The first is education, which is what you're trying to do, or what you're doing for the public. You're trying to educate them that there's a need to move. Part of that education is that we've talked about the need for supplements. Now, diet has a lot to do with spine health in several different dimensions. So let's pick the first dimension. The first dimension is encourage your children to consume meals that will provide for them vitamin D and calcium. The egg, the butter, the cheese, the milk. Children. Encourage the middle-aged persons to take calcium, vitamin D3 as supplements, especially as they are growing away from 30-ish. They should start taking it so that they can start building their bone stock.
Let me just pause you there to quickly note that you told us to give our children eggs.
Why not?
You remember there was a time they said children shouldn't take eggs?
I'm not sure that was recommended by a doctor. I'm not sure that was.
Okay, please continue.
Now, then the other dimension of diet is that diet does not include alcohol, so that is a negative diet.
All right.
Yes, diet does not include cigarette smoking. That's a negative diet. Now, as much as possible, the heavier the patient is, the more stress there is on the back. So that is still dietary.
Let me see if we can get Ademola on the line. Hello, Ademola.
Yeah,
what's your question? Good morning.
Yeah, I would like to speak with the doctor, please.
Please go right ahead.
Okay, I want to ask a question concerning people that have a spinal cord injury. I learned that there is some drug that are trying to develop in America. That is the NPG-291. I don't know what's the latest about that one, or is there any other new development concerning people that have a spinal cord?
Okay, thank you, Demola. You did tell me that the spine is not exactly the spinal cord, but do you know about this medication he's talking about? I can't even repeat the name.
Let me explain it. Now, the spine is, like you said, the vertebral column. And like in your intro, you mentioned from the base of the brain, you have the spinal cord inside.
That's right.
The vertebral column. So it's casing, and content. Casing to protect the content. Apart from moving, it's there to protect the content. Now, injury at times to the casing can cause injury to the content. Some of the injuries can be very bad as being irredeemable by today's medicine. Now, what modern science has done, 2 things. These persons, unfortunately, cannot move. So we have devices that can help them move, like an outside skeleton that they wear that can help them stand up, help them move almost like robots. Those ones are in existence. Very expensive.
People wear those?
People wear it. I mean,
do they wear them in this country?
I've not seen a patient in this country that has worn it, but you can imagine somebody who used to walk around. All of a sudden, the person can't walk. The person can't stand. The day that person stands up, it's like you give that person a new lease of life. So those exoskeletons are there, and a lot of patients appreciate it. Now, there's also genetic engineering going on as to how those nerves that have been injured in the cord can be repaired. Now, there are different reports about success rates, but it has not been fully.
It's still under
It's still
investigation.
under research, is still ongoing, but we are hopeful that someday, soon, a patient that has a spinal cord will get some injections, some medications, and
modern medicine keeps moving. Let's take this call from Angela. Hello, Angela. What's your question?
Hello. Good afternoon, ma'am. Hello,
Good
doctor.
afternoon.
good afternoon.
My question is, I just delivered last 3 months, but in between my legs and the bone is as if one is up and the other one is down. Is that also related to spinal cord issue?
I didn't get part of your statement. What bone exactly are you talking about? That seems one is up and one is down.
My lab, the
Oh,
joint that is holding my lab to my body.
okay. All right. I'll let the doctor answer that.
Good. Thank you very much, Angela, for your question. Angela's question takes me to another part of the theme of the World Spine Day, seeking appropriate health care support. What I would advise Angela is that if you feel that you have a problem with your back, such that your legs are not moving well, that is a spine problem. Seek for expert care. And we're in Lagos. Expert care is more available in Lagos than in most of the states. So seek for it. You can go to government hospitals like the National Orthopedic Hospital. You can go to some general hospital in Kenya. Lasuth, you will get people who will be able to investigate you and advise you on appropriate therapy.
Following through from Angela's question, I wanted to ask, there's something we've heard of called referred pain. Can somebody have a spine problem and it be reflecting in other parts of the body? And then how does the person know?
There are two sides to that story. The spine has friends. I'm being very simplistic here.
Yes.
The spine has friends. Organs and tissue that developed around the spine. Some of them, like the uterus, the kidneys, some of them, when they have problems, the spine feels the pain as well.
Okay.
That is one.
Okay.
Then the spine has nerves. I'll give you an example. You can imagine 2 or 3 nerves that are coming out of the spine. They will supply the facet joints at the spine. Then they will go ahead and supply some muscles and some part of the skin lower in the leg. But those nerves are the same nerves. So they are like siblings, if I can say.
Family.
Siblings. If you say family, it's even far. Siblings, because the same nerves. So if there is a problem that affects those nerves, before they split, they will both weep for each other. So the patient will have back pain, and the patient will have pain in the lower part of the leg.
Wow. I see the reason one has to see the doctor. Bimbo is on the line. Hello, Bimbo. What's your question? Okay, we seem to have lost Bimbo. But that's a lot. So when exactly should somebody say, I think I have a problem with my back. I want to go to the hospital. I need to go to the hospital.
Okay. Whenever we have what we call non-specific low back pain, there are some pains that we all have, 3, 4, 5 days. I'm standing up, I'm feeling pain. I'm sitting down, I'm feeling pain. No big deal. 3, 4 days, and it goes away. Fine. But any pain that doesn't go away, seek help. Speak to a doctor, not necessarily a spine doctor. He will now evaluate and say, look, I think this thing needs to be seen by somebody else who is more into this area. And then you get referred, that is it. So it's better, rather than keep it at home, because we have a disease in our area, that's part of the education, people keep the problems until they are pretty late before they now present.
And then degeneration has happened.
Yes.
And you can't come back from that far.
Yeah.
Doctor, it's been a pleasure. Wonderful.
My pleasure.
I know there's so much more you can tell us, but we're out of time. Thank you so much for coming to the show.
Thank you very much for inviting me.
Thank you, everybody, for listening in and joining us on the show. Thank you for your calls. Ademola, Angela, Bimbo, wonderful questions. Have a lovely day. I am Mary Alali.